Okay, this video is called Advice for Surgeons on Blood Flow, Healing, and Prevention of Complications. So first of all, everything heals better with good blood flow. All right, and by the way, I did a fellowship in interventional radiology, sort of imaging-guided surgery at Harvard. Brigham and Women's Hospital was my main focus. I also rotated through Massachusetts General. And I've seen some things over the years from surgery, especially with regard to preventing postoperative complications. And it's stuff that is not taught in med school or most residency programs. I spent a long time hanging around with vascular surgeons, and I've never heard them talk about this stuff. So I think there's a good chance it'll be helpful to you and that you haven't heard it before. So how does one improve blood flow? And it's really pretty simple. You want to minimize dietary fat. Dietary fat makes the red blood cells clump together. You can call it blood sludge, clumping, rouleau formation, and that will decrease tissue oxygenation. It also increases the risk of, it's prothrombotic, increases the risk of myocardial infarction. The tissue hypoxia decreases healing. You increase your risk of a post-op MI. Also, when you improve tissue oxygenation, it'll help the patient to be more able to come off the ventilator and avoid the complications associated with that. High-fat diet also decreases immune system function. For much more detailed explanations, I made multiple lectures on blood flow. I got lectures on the effect of a high-fat meal on blood flow. Sodium is also detrimental to blood flow. It's a vasoconstrictor, inhibits endothelial nitric oxide. Sodium is very common and high in processed foods, and it's commonly used as a flavorant or preservative in meat. I've got extensive lectures on sodium and hypertension where I go through that. A more recent lecture on the ratio of potassium to sodium. It's called the K factor. You want that at least 5 to 1. So what am I talking about? For your patients in the post-op phase, I think it's important that you pay close attention to their diet that can help them get through that difficult post-op phase. Potassium and magnesium are vasodilators. Potassium is really sort of the opposite of sodium. It gets the plasma membrane, potassium-sodium ATPase pumps to work effectively to maintain a good sodium electrochemical gradient so the cells can do what they need to do to heal. Plants are a great source of potassium. Magnesium is right in the center of chlorophyll, so plants are great sources of potassium and magnesium. You'll see the K factor ratio of potassium to sodium is like 10 to 1 or higher routinely in plant foods, whereas it's the opposite in processed foods. It's routinely higher sodium than potassium. All animals on this earth, the mammals, they all eat higher potassium than sodium except for humans. Let's see, what else? Low-fat, low-sodium diet improves blood flow. I've also got videos on abdominal pressure syndrome that if you're interested in how the abdomen works and the benefits of dietary fiber, that goes through that in more detail. So anyways, hope this will help you for better wound healing, fewer infections, and better outcomes.